Hello and welcome to Caring with Dignity Limited. We are happy to share information about how our staff members are winning clients. Most companies lose business when the support assistants fail to deal with aggressive clients, so today I will share information about how to deal with aggressive clients and what our care personal assistants do. We understand that operating within a care environment, whether in a residential facility or through home care, introduces distinct challenges. Among the most challenging and potentially distressing scenarios is managing an aggressive client. Aggression, whether expressed verbally or physically, can create an uncomfortable atmosphere for both the personal care assistant and the client. It is essential to comprehend the possible underlying causes and to have a clear strategy for de-escalation to ensure a safe and nurturing environment. We invest a large amount of time to train our staff how to deal with aggressive clients. Our team members always try to understand the root cause of the aggression. We have certain parameters to measure aggression, such as underlying medical conditions. Dementia, Alzheimer's, and other neurological disorders can impair judgment and communication, leading to frustration and aggression. Pain, infections, and even medication side effects can also be triggers. Frustration and communication barriers. Clients may lash out if they struggle to express their needs, desires, or discomfort. Language barriers, cognitive impairments, and feeling unheard can all contribute to frustration. Environmental factors. Overstimulation, loud noises, unfamiliar surroundings, and changes in routine can be overwhelming and lead to agitation. Even seemingly minor disruptions can trigger a negative response. Unmet needs. Feeling hungry, thirsty, cold, lonely, or bored can lead to increased irritability and potential outbursts. Psychological factors. Anxiety, depression, trauma, and past experiences can influence behavior. A client may be reacting to something reminiscent of a past stressful situation. Powerlessness and loss of control. Individuals in care settings often experience a loss of independence and control over their lives. This feeling of helplessness can manifest as aggression. We use effective strategies for de-escalation and management. Once the staff members acknowledge the potential drivers behind the aggression, they implement effective de-escalation strategies. Prioritize safety. Our safety and the safety of clients are paramount. If we feel physically threatened, remove ourselves from the situation and seek assistance immediately. Know our protocols for handling aggressive incidents. Remain calm and empathetic. Our emotional state significantly impacts the situation. Speak in a slow, calm, and reassuring tone. Avoid raising voice or showing signs of frustration. Acknowledge the client's feelings by saying things like, "I understand you're feeling upset." Active listening. Pay close attention to what the client is saying, both verbally and non-verbally. Try to understand their perspective, even if we don't agree with it. Ask clarifying questions and reflect back what we hear to ensure understanding. Nonverbal communication. Maintain a non-threatening posture. Avoid crossing arms, standing too close, or making direct, prolonged eye contact, which can be perceived as confrontational. Offer choices and control. Where possible, offer the client choices to help them regain a sense of control. For example, would you prefer to sit here or by the window? Would you like some juice or water? Distraction techniques. Redirect the client's attention using a favorite activity, a familiar object, or a pleasant memory. Engaging them in a gentle conversation about a topic they enjoy can also be effective. Modify the environment. If possible, reduce environmental stressors by dimming the lights, reducing noise levels, or removing distractions. A calm and quiet environment can often help to diffuse a situation. Respect personal space. Be mindful of personal boundaries. Avoid touching the client unless it's necessary and appropriate. Know the client's history and triggers. Review the client's care plan and history to identify any known triggers for aggressive behavior. This information can help you anticipate and prevent potential problems. Seek support. Don't hesitate to ask for help from colleagues, supervisors, or other healthcare professionals. Debriefing after a difficult encounter is essential for your own well-being. Dealing with aggressive clients can be emotionally challenging, but by understanding the underlying causes, implementing effective de-escalation strategies, and prioritizing prevention, you can create a safer and more supportive environment for everyone in the care setting. Remember that patience, empathy, and a well-defined approach are your most valuable tools in these situations. For more information, please visit our website, www.caringwithdignity.co.uk, or call us. Thank you